Question 1. What is the primary purpose of conducting a functional behavior assessment, FBA? A. To determine a client's IQ level. B. To understand why a behavior is happening. C. To teach the client academic skills. D. To punish challenging behavior. Answer. B. To understand why a behavior is happening. This question is asking about the main goal of a functional behavior assessment, or FBA. The keyword primary purpose tells you we need to identify its core function. An FBA isn't about intelligence testing or teaching new school subjects, and it definitely isn't about punishment. Its whole point is to figure out the function or why behind a challenging behavior, what the person gets out of doing it. For example, is a child screaming to get attention, to escape a task, or to get a toy? Understanding the function is crucial because it guides us on how to help change the behavior in a helpful way. So, remember, FBA is all about playing detective to find out why a behavior is happening. Question 2. Which of the following is the best example of discontinuous measurement? A. Counting every time a client says hello. B. Measuring the exact time a behavior lasts. C. Recording if a behavior occurred at any point during an interval. D. Tracking the total number of times a client washes their hands in a day. Answer. C. Recording if a behavior occurred at any point during an interval. This question asks about discontinuous measurement, which is a way of tracking behavior that doesn't count every single instance. The clue is discontinuous, meaning not continuous or ongoing tracking of every occurrence. Counting every instance, frequency, or measuring duration are types of continuous measurement. Recording if a behavior happened at all within a specific time block. An interval, like in interval recording methods, is discontinuous because you're not tracking the start and end of every instance, just its presence in that interval. It gives you an estimate rather than an exact count. For instance, you might check every 5 minutes if a child is playing appropriately. If they are, you mark it for that interval, regardless of how long they played within that 5 minutes. Think of discontinuous measurement as taking snapshots instead of a full video recording. Question 3. What is the role of an RBT in the Behavior Intervention Plan, BIP? A. To create and design the BIP. B. To implement the BIP as written. C. To modify the BIP if it's not working. D. To supervise other RBTs implementing the BIP. Answer. B. To implement the BIP as written. This question focuses on the specific duties of an RBT related to a Behavior Intervention Plan, or BIP. The key is understanding the RBT's scope of practice, what they are trained and authorized to do. RBTs are crucial team members, but their role is primarily to put the plan into action exactly as instructed by their supervisor. Creating, designing, or modifying a BIP requires higher-level clinical judgment and is the responsibility of a BCBA or BCABA. Supervising other RBTs is also a supervisor's role, not an RBT's. So your main job with a BIP is to follow the instructions carefully and consistently. Remember, RBTs implement the plan, they don't create or change it. Question 4. When graphing behavior data, what does the y-axis typically represent? A. Time. B. The specific date or session number. C. The measurement of the behavior example count, percentage. D. The different behaviors being tracked. Answer. C. The measurement of the behavior example count, percentage. This question is about understanding the basics of graphing behavior data, a common task for RBTs. The y-axis is the vertical line on a graph. Think about how you typically graph progress or levels of something. The amount or quantity is usually on the vertical axis. In behavior analysis, the y-axis usually shows the measure of the behavior itself, like how many times it happened, frequency, how long it lasted, duration, or the percentage of opportunities it occurred. The x-axis, on the other hand, typically represents time, like days or sessions. So, when you look at a behavior graph, The height of the data point on the y-axis tells you how much of the behavior occurred. Keep in mind, I is always about the amount of behavior you measured. Question 5. Which ethical principle involves promoting the client's independence and self-sufficiency? A. Beneficence, doing good. B. Non-maleficence, avoiding harm. C. Autonomy, respecting choice. D. Fidelity, being truthful. Answer C. Autonomy, respecting choice. This question tests your knowledge of core ethical principles in ABA practice. The clue here is promoting the client's independence and self-sufficiency. While beneficence is about doing good and non-maleficence is about avoiding harm, both very important. The principle that directly relates to supporting a person's right to make choices and control their own life as much as possible is autonomy. It means respecting their rights, preferences, and wishes, and helping them gain skills to become more independent. Fidelity is about being trustworthy and truthful. So, when you're helping a client learn skills to do things for themselves or respecting their choices whenever possible, you're upholding the ethical principle of autonomy. Question 6. What is reinforcement? A. An event that happens after a behavior that makes that behavior less likely to happen in the future. B. An event that happens after a behavior that makes that behavior more likely to happen in the future. C. Giving a client something they like regardless of their behavior. D. Taking away something unpleasant to decrease a behavior. Answer. B. An event that happens after a behavior that makes that behavior more likely to happen in the future. This is a fundamental concept in ABA. Reinforcement. The definition of reinforcement is all about the effect an event has on future behavior. The key part is that it makes the behavior more likely to happen again. This consequence, whether it's getting something good, like praise or a toy, or having something bad taken away, like a chore, acts as a reinforcer only if the behavior increases afterward. Option A describes punishment, which decreases behavior. Options C and D might be parts of reinforcement procedures, but don't fully define the term based on its effect. Think of reinforcement like giving a behavior a boost so it happens more often. Question 7. When implementing discrete trial training, DTT, what is the role of the prompt? A. To signal that reinforcement is coming. B. To help the client give the correct response. C. To punish incorrect responses. D. To end the trial. Answer B. To help the client give the correct response. This question is about discrete trial training, DTT, a structured teaching method often used in ABA. In DTT, a prompt is a specific type of help given to the client after the instruction, the discriminative stimulus, or SD, but before they respond. Its purpose is to make it more likely that the client will get the answer right. Prompts aren't about punishment or just ending the trial. They are temporary supports, like guiding a hand, saying part of the answer, or pointing, that are faded away as the client learns. Think of a prompt as a temporary training wheel to help the learner respond correctly. Question 8. Which of the following is an example of frequency recording? A. Counting how many minutes a client spends reading. B. Tallying the number of times a client raises their hand in class. C. Marking if a client engaged in a behavior at the end of a 10-minute interval. D. Recording the exact time a tantrum began and ended. Answer B. Tallying the number of times a client raises their hand in class. This question asks about frequency recording, which is a common way to measure behavior. Frequency means count, literally how many times a behavior happens. Option A is duration measurement. Option C is a type of interval recording, discontinuous measurement. Option D involves duration, start, and end times. Tallying the number of times something occurs, like raising a hand or saying a specific word, is exactly what frequency recording is. You're simply counting occurrences within a specific observation period. If you can count the behavior, you can use frequency recording. Question 9. What is extinction? A. providing reinforcement every time a behavior occurs. B. Withholding reinforcement for a previously reinforced behavior. C. Providing punishment after a behavior occurs. D. Reinforcing a different behavior instead of the challenging one. Answer: B. Withholding reinforcement for a previously reinforced behavior. This question asks about extinction, a procedure used in behavior reduction. Extinction is specifically about stopping the delivery of the reinforcement that was previously maintaining a challenging behavior. If a child screams to get attention, attention is the reinforcement. Putting the behavior on extinction means no longer giving attention when they scream. The idea is that if the behavior no longer works to get the desired outcome, it will eventually decrease. Options A and C describe other procedures, continuous reinforcement and punishment, respectively. Option D describes differential reinforcement. Remember, extinction isn't ignoring the person. It's strategically withholding the specific thing that was making the behavior happen. Question 10. If a client is learning to identify colors and the therapist holds up a red card and says, "Point to red," this is an example of A. A consequence. B. A prompt. C. A discriminative stimulus. SD. D. Reinforcement. Answer: C. A discriminative stimulus. SD. This question is about identifying the different parts of a teaching trial or the three-term contingency. Antecedent behavior consequence. The event that happens before the behavior and signals that a specific response will be reinforced is called the discriminative stimulus, or SD. In this case, the therapist holding up the red card and saying "point to red" is the instruction or cue given to the client, telling them what response is expected. A prompt would be help given after this instruction. The response is the client pointing. The consequence, like praise, comes after the response. So the SD is the signal that sets the occasion for a particular behavior. Question 11. What is the ethical responsibility of an RBT regarding client confidentiality? A. Share client information freely with anyone involved in their care. B. Discuss client details with family members only. C. Keep all client information private and only share with authorized individuals when necessary. D. Post general updates about client progress on social media without using names. Answer: C. Keep all client information private and only share with authorized individuals when necessary. This question addresses the critical ethical principle of client confidentiality. Protecting a client's private information is a cornerstone of ethical practice. You should never share client details freely or post about them publicly, even without names, as identifying information might be included or inferred. Sharing should only happen with other team members or relevant parties who are directly involved in the client's care and have a legitimate need to know, and often only with consent. Maintaining confidentiality builds trust and respects the client's right to privacy. Your golden rule: if in doubt, don't share, and always ask your supervisor. Question 12. Which type of data recording would be best to use if you want to know how long a client engages in a specific behavior, like playing independently? A. Frequency recording. B. Duration recording. C. Partial interval recording. D. Momentary time sampling. Answer: B. Duration recording. This question asks you to choose the best measurement method for a specific type of behavior data. How long a behavior lasts. The keyword here is how long, which directly points to duration. Frequency recording counts how many times it happens. Partial interval recording and momentary time sampling are methods used to estimate behavior occurrence within intervals, not measure the exact length of each instance. Duration recording means you start a timer when the behavior begins and stop it when it ends, giving you a precise measure of how long the behavior occurred. If the length of time is what you care about, duration is your go-to method. Question 13. When a client is learning a new skill, reinforcement should ideally be delivered. A. Only after the skill is mastered perfectly. B. randomly, and unpredictably. C. Immediately after the correct response. The several minutes after the correct response to avoid dependence. Answer. C. Immediately after the correct response. This question is about the timing of reinforcement when teaching new skills. For learning to be most effective, especially with beginners, reinforcement needs to happen very quickly after the desired behavior occurs. This helps the client clearly understand which behavior earned the reward. Waiting too long, D, can be confusing. They might associate the reward with a different behavior that happened later. Reinforcing only perfect responses, A, is usually too restricted for learning. You start by reinforcing approximations. Random reinforcement, B, is used for maintaining established behaviors, not teaching new ones. So think fast. Immediate reinforcement helps make the connection clear. Question 14. What is an operational definition of a behavior? A. A diagnosis given to the client. B. A subjective description of the behavior. C. A clear, concise, and measurable description of the behavior. D. The therapist's interpretation of why the behavior is happening. Answer. C. A clear, concise, and measurable description of the behavior. This question asks about an operational definition, which is fundamental to accurate behavior measurement. An operational definition isn't a diagnosis, a personal interpretation, or a vague description. It's a way of describing the behavior so clearly that anyone observing it can agree on whether or not it happened. It should be objective, focusing on what the behavior looks or sounds like, and include specific start and end points if applicable. For example, instead of the child was disruptive, an operational definition might be screaming, loud vocalizations lasting greater than 2 seconds, or hitting forceful contact with open hand. Another person. This clear description makes sure everyone on the team is tracking the same thing consistently. Question 15. Which prompt involves physically guiding the client through the desired response? A. Gestural prompt. B. Vocal prompt. C. Model prompt. D. Full physical prompt. Answer. D. Full physical prompt. This question is asking about different types of prompts used in teaching. The key phrase here is physically guiding the client. A gestural prompt is pointing or nodding. A vocal prompt involves saying something. A model prompt is demonstrating the behavior. A full physical prompt means you are actually using your hands to help the client perform the action, like hand-over-hand guidance. It's the most intrusive type of prompt because you are directly assisting the movement. Think of it as actually moving their body to do the target skill. Question 16. What is the purpose of conducting a baseline measurement before starting an intervention? A. To show that the intervention is needed. B. To determine the level of the behavior before intervention begins. C. To teach the client about the intervention. D. To predict the future level of the behavior. Answer. B. To determine the level of the behavior before intervention begins. This question is about baseline data, which is collected before you start trying to change a behavior. The point of baseline is to get a clear picture of how often, how long, or how intensely the behavior is happening without any intervention in place. This provides a starting point so you can later compare the behavior during the intervention to see if the intervention is having an effect. It's like taking a before picture to compare to the after picture. While baseline might show the behavior needs intervention, its purpose is specifically to establish that initial level. Question 17. Which of the following is an example of negative reinforcement? A. Giving a child a sticker for cleaning their room. B. Taking away a preferred toy when a child hits. C. A person takes an aspirin to get rid of a headache. D. A dog sits and gets a treat. Answer. C. A person takes an aspirin to get rid of a headache. This question is about negative reinforcement, which is a sometimes confusing concept. Remember, reinforcement always means the behavior increases in the future. Negative means something is taken away. So, Negative reinforcement is when a behavior is followed by the removal of something unpleasant, and as a result, the behavior happens more often. In option C, the unpleasant thing is the headache. Taking the aspirin, the behavior removes the headache, and thus the person is more likely to take aspirin in the future when they have a headache. Options A and D are positive reinforcement, adding something good. Option B is punishment, taking away something good to decrease behavior. A simple way to think of negative reinforcement. Doing something to escape or avoid something unpleasant makes you more likely to do that thing again. Question 18. An RBT is asked to collect data on spitting behavior. The supervisor defines spitting as expelling saliva from the mouth onto a surface or person. This is an example of A, the function of the behavior, B, an antecedent, C, an operational definition, D, a consequence. Answer C, an operational definition. This question refers back to the concept of defining behaviors for measurement. The phrase expelling saliva from the mouth onto a surface or person is a specific, observable, and measurable description of what spitting looks like. This is exactly what an operational definition provides. It tells you exactly what to look for to count it as an instance of the behavior. It doesn't tell you why the person is spitting. That's the function. What happened before it? That's the antecedent. Or what happened after it? That's the consequence. Remember, an operational definition is just describing the behavior itself, like giving it a clear label with instructions on how to identify it. Question 19. What is the primary difference between positive and negative reinforcement? A. Positive reinforcement is good, negative reinforcement is bad. B. Positive reinforcement involves adding something, negative reinforcement involves taking something away. C. Positive reinforcement increases behavior, negative reinforcement decreases behavior. D. Positive reinforcement uses tangible items, negative reinforcement uses praise. Answer B. Positive reinforcement involves adding something, negative reinforcement involves taking something away. This question tests your understanding of the terms positive and negative in ABA, specifically regarding reinforcement. In ABA, positive means adding something after a behavior, and negative means removing something after a behavior. Crucially, both positive and negative reinforcement increase the future likelihood of the behavior. That's what reinforcement means. Option A uses everyday meanings of positive/negative, not the technical ABA terms. Option C is incorrect because both increase behavior. Option D is about the type of reinforcer, not the process. So the core difference is whether you add something positive or take something away negative, following the behavior to make it happen more often. Question 20. Which type of prompt fading involves gradually reducing the amount of physical guidance provided? A. Time delay. B. Stimulus fading. C. Response fading, example, physical prompt fading. E. Most to least prompting. Answer C. Response fading, example, physical prompt fading. This question is about prompt fading, which is how you gradually remove prompts so the client responds independently. The key is reducing the help provided in the response itself. Time delay involves waiting longer before giving a prompt. Stimulus fading involves gradually changing a stimulus, like making a picture less bright. Response fading is specifically about making the prompt less intrusive over time. For example, going from full physical guidance to light touch, then just a gesture, and finally no physical prompt at all. Most to least is a strategy for using prompts, starting with the strongest and fading. So, fading the physical guidance is a type of response fading. Question 21. What is the main goal of conducting a task analysis? A. To determine the function of a challenging behavior. B. To break down a complex skill into smaller, manageable steps. C. To identify a client's preferred items. D. To measure the frequency of a behavior. Answer B. To break down a complex skill into smaller, manageable steps. This question asks about the purpose of a task analysis. The key phrase, complex skill, is a big clue. A task analysis is a teaching strategy where you take a multi-step skill, like washing hands or brushing teeth, and break it down into all the individual, smaller steps that make up the complete task. This makes it easier to teach and measure each part. It's not used for finding behavior functions, identifying preferences, or measuring simple frequencies. It's specifically about dissecting a longer process into bite-sized pieces for teaching. Think of it like writing a recipe, breaking down cooking into sequential steps. Question 22. What is the term for a consequence that decreases the future likelihood of a behavior? A. Reinforcement. B. Punishment. C. Extinction. D. Prompt. Answer: B. Punishment. This question asks for the term that describes a consequence that makes a behavior less likely to happen again. Reinforcement, both positive and negative, increases behavior. Extinction involves withholding reinforcement, which eventually decreases behavior, but the procedure itself is called extinction, not punishment. A prompt is help given before the behavior. Punishment is defined by its effect. If a consequence makes the behavior occur less often in the future, it's punishment. Remember, punishment isn't necessarily mean or harsh. In ABA, it's simply a term for a consequence that reduces behavior. Question 23. When providing feedback to a client, what should be the focus? A. Only on what the client did wrong. B. Only on what the client did right. C. On specific behaviors, both correct and incorrect, with guidance. D. On comparing the client's performance to others. Answer: C. On specific behaviors, both correct and incorrect, with guidance. This question is about giving effective feedback. Focusing only on negatives, A, can be discouraging, and focusing only on positives, B, doesn't help the client improve on areas they need to work on. Comparing clients, D, is inappropriate and unprofessional. Good feedback is specific and addresses actual behaviors. It involves acknowledging what was done well and clearly explaining what needs to be changed or how to do it correctly next time. It's about guiding future performance, not just praising or criticizing. Think of it as coaching, pointing out successes, and providing direction for improvement. Question 24. An RBT is observing a client and records whether a behavior is occurring at the exact moment a timer goes off. This is an example of A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Duration recording. Answer: C. Momentary time sampling. This question describes a specific discontinuous measurement method. The key phrase is at the exact moment a timer goes off. In momentary time sampling, you set a timer, and when it beeps, you look to see if the behavior is happening right then. Partial interval recording means you mark if the behavior happened at any point during the interval. Whole interval recording means you mark only if the behavior happened for the entire interval. Duration is how long the behavior lasts, so checking only at a specific moment is the defining characteristic of momentary time sampling. Question 25. What should an RBT do if they are asked to implement a procedure they are not trained on? A. Attempt to figure it out by watching others. B. Decline and inform their supervisor. C. Read about it online and then try it. D. Ask the client's parent for instructions. Answer: B. Decline and inform their supervisor. This question addresses a crucial ethical and professional responsibility for RBTs. RBTs must practice within their scope of competence and training. If you are given a task or procedure you haven't been trained on, it is unsafe and unethical to attempt it. You should politely decline to implement it and immediately communicate with your supervisor about the request and your need for training. You should never try to learn complex procedures on your own through observation, online research, or asking family members, as this could harm the client or be ineffective. Your supervisor is there to provide guidance and necessary training. Always prioritize client safety and follow your supervisor's direction. Question 26. Which term describes an environmental event that occurs before a behavior? A. Consequence. B. Antecedent. C. Response. D. Stimulus control. Answer. B. Antecedent. This question is about the three-term contingency, ABC, which is a core concept in ABA. The A stands for antecedent, which is everything that happens immediately before the behavior, the B. The C stands for consequence, which happens immediately after the behavior. The response is the behavior itself. Stimulus control refers to when a behavior is more likely to occur in the presence of a specific antecedent. So, the event that comes before the behavior is always the antecedent. Think of the ABCs. Antecedent, greater than behavior, greater than consequence. Question 27. What is the purpose of using prompts when teaching a new skill? A. To prevent the client from making errors. B. To assess the client's current skill level. C. To increase the likelihood of the correct response. D. To decrease the need for reinforcement. Answer. C. To increase the likelihood of the correct response. This question revisits the use of prompts. As discussed before, prompts are helps given to the client. While they can help reduce errors, A. That's a benefit, not the primary purpose. They aren't used for assessment. B. And they don't decrease the need for reinforcement. D. In fact, prompts are often used to ensure a correct response that can be reinforced. The main goal of a prompt is to make it easier and more likely for the learner to perform the correct behavior when given an instruction. You use them to set the client up for success and allow you to reinforce the correct behavior. Question 28. An RBT takes a break and leaves a client unattended in a room with potential safety hazards. Which ethical principle is primarily violated? A. Beneficence, doing good. B. Non-maleficence, avoiding harm. C. Fidelity, being truthful. D. Justice, fairness. Answer. B. Non-maleficence, avoiding harm. This question presents a serious ethical scenario. Leaving a vulnerable client unsupervised in a potentially unsafe environment directly puts them at risk of injury or harm. The ethical principle of non-maleficence specifically requires professionals to do no harm, while leaving a client unattended might also violate other principles or policies. The most direct and significant violation in this scenario is the failure to protect the client from potential danger, thus violating the commitment to avoid causing harm. Always ensure client safety is the top priority and never leave a client unsupervised without explicit instruction and safety measures in place. Question 29. Which measurement procedure involves dividing an observation period into small intervals and recording if a behavior occurred at any point within each interval? A. Frequency recording. B. Duration recording. C. Partial interval recording. D. Momentary time sampling. Answer. C. Partial interval recording. This question describes another type of discontinuous measurement. The key phrases are dividing, into small intervals, and at any point within each interval. This matches the definition of partial interval recording. If the behavior happens even briefly at any moment during the specified time block, you mark it for that interval. This often overestimates the behavior's true occurrence compared to continuous measurement. Frequency and duration are continuous methods. Momentary time sampling checks only at the end of the interval. Remember, partial interval recording is about whether the behavior partially or briefly occurred during the interval. Question 30. When using positive reinforcement, the positive refers to A. A good or pleasant consequence. B. The consequence making the behavior stronger. C. Adding something to the environment. D. The behavior being socially acceptable. Answer. C. Adding something to the environment. This question tests your understanding of positive in the term positive reinforcement. Just like in negative reinforcement, positive here is a technical term from math meaning adding or presenting something. It doesn't mean good or pleasant in the everyday sense. It means you are adding a stimulus or event to the situation after the behavior occurs. The reinforcement part means that this addition increases the behavior. So, positive reinforcement is when you add something, like praise, a sticker, a snack, after a behavior, and because you added it, the behavior happens more often in the future. Question 31. What is the primary purpose of using visuals, such as picture schedules or communication boards, with clients? A. To entertain the client. B. To make therapy look more appealing. C. To provide clear structure, expectations, and communication support. D. To replace verbal instructions entirely. Answer: C. To provide clear structure, expectations, and communication support. This question asks about the utility of visual supports in ABA. Visuals aren't just for fun or aesthetics, and they don't typically replace all verbal communication. Their main benefit is providing clear, consistent information in a format that many learners, especially those with communication or processing challenges, find easier to understand than spoken words alone. They offer structure by showing what's happening next, clarify expectations, and give the client ways to communicate their needs or choices. Think of visuals as helpful tools that make the environment and expectations more predictable and understandable for the client. Question 32. Which of the following is an example of stimulus control? A. A child screams in the grocery store to get candy. B. A student raises their hand only when the teacher is looking. C. A person takes a break when they feel overwhelmed. D. A dog sits when told sit, but not when told bark. Answer: D. A dog sits when told sit, but not when told bark. This question asks about stimulus control, which means a behavior is more likely to happen in the presence of a specific stimulus, the SD, than in its absence or in the presence of other stimuli. In option D, the dog sitting behavior is under the control of the verbal stimulus sit. It happens reliably when sit is said, but not when a different instruction, bark, is given. This shows the behavior is linked to a specific cue. Option A is about the function of a behavior, getting candy. Option B is closer, as the teacher looking is an SD, but the only when makes it a strong example. Option C is an internal behavior, taking a break. The clearest example of stimulus control is when a behavior is reliably triggered by one specific signal and not others. Question 33. What is the purpose of thinning a reinforcement schedule? A. To deliver reinforcement for less desirable behaviors. B. To gradually reduce the frequency of reinforcement. C. To make the reinforcement more powerful. D. To switch from positive to negative reinforcement. Answer B. To gradually reduce the frequency of reinforcement. This question asks about thinning a reinforcement schedule. When teaching a new skill, you often start by reinforcing correct responses every single time. Continuous reinforcement. Once the skill is learned, you don't need to reinforce it constantly. Thinning means gradually requiring more responses or longer periods of time between reinforcements. This makes the behavior more resistant to extinction and prepares the client for reinforcement schedules found in the natural environment, where reinforcement doesn't happen every single time. It's about making the client's behavior more independent of constant rewards. Question 34. If a client bites their hand, behavior, and the RBT immediately provides attention. Consequence. And the biting increases in the future. The attention served as A. Punishment. B. Extinction. C. Positive reinforcement. D. Negative reinforcement. Answer C. Positive reinforcement. This question describes a specific scenario using the three-term contingency and asks about the function of the consequence. The behavior is biting. The consequence is the RBT providing attention. because the question states the biting increases in the future, we know the consequence was a type of reinforcement. Since attention was added after the behavior, it is positive reinforcement. It wasn't punishment because the behavior increased. It wasn't extinction because reinforcement was provided, not withheld. It wasn't negative reinforcement because something was added. Attention, not taken away. The attention, in this case, accidentally strengthened the biting behavior. Question 35. What is the primary role of the RBT regarding parent/guardian communication? A. To provide clinical interpretations of data and make treatment decisions. B. To discuss specific programming questions or concerns raised by the parent/guardian. C. To answer general questions about the session and collect parent input as directed by the supervisor. D. To modify the client's goals based on parent feedback. Answer. C. To answer general questions about the session and collect parent input as directed by the supervisor. This question is about appropriate communication boundaries for RBTs. While collaboration with families is important, RBTs operate under the supervision of a BCBA or BCABA. It is the supervisor's role to discuss clinical decisions, interpret data, modify goals, and address specific programming concerns in detail. RBTs can and should communicate with parents about what happened during the session in a general way, share enthusiasm about progress as appropriate and directed, and crucially, gather any information or concerns the parent shares to pass on to their supervisor. You are the eyes and ears, but your supervisor is the lead clinician making plan adjustments. Always refer clinical questions to your supervisor. Question 36. Which ethical guideline requires RBTs to avoid any relationships that could impair their objectivity or exploit the client? A. Confidentiality. B. Professionalism. C. Avoiding multiple relationships and conflicts of interest. D. Integrity. Answer. C. Avoiding multiple relationships and conflicts of interest. This question directly addresses the ethical guideline about the relationships RBTs have with clients and their families. A multiple relationship is when you have a professional relationship as an RBT, and another type of relationship, like a friend, business partner, etc., with the same person or family. This can create conflicts of interest, compromise your professional judgment, or lead to exploitation. Confidentiality is about privacy. Professionalism and integrity are broader terms. This specific guideline highlights the importance of maintaining clear professional boundaries to protect the client and ensure unbiased service delivery. Keep your relationship with clients strictly professional. Question 37. What is a behavior chain? A. A single, simple behavior like clapping hands. B. A sequence of behaviors where each step provides the cue for the next step. C. A behavior that is difficult to change. D. Multiple people engaging in the same behavior simultaneously. Answer. B. A sequence of behaviors where each step provides the cue for the next step. This question asks about a behavior chain, a common concept in teaching complex skills. A behavior chain isn't a single behavior or multiple people doing something. It's a series of individual steps linked together in a specific order to complete a task. For example, washing hands involves turning on the water, wetting hands, getting soap, rubbing hands, rinsing, turning off water, and drying. Each completed step, like getting soap, serves as the signal, SD, to perform the next step, rubbing hands. Task analysis breaks down these chains so they can be taught using chaining procedures. Question 38. When teaching a client to follow instructions, the instruction given example, touch your nose, is the A. Response. B. Consequence. C. Discriminative stimulus, SD. D. Reinforcer. Answer. C. Discriminative stimulus, SD. This question is another look at the ABCs, specifically identifying the antecedent in a teaching situation. The instruction given by the therapist is the environmental event that happens before the client's behavior, touching their nose, and signals that the behavior is expected and will likely lead to a consequence. This is the definition of the discriminative stimulus, or SD. The response is the client touching their nose. The consequence comes after the response. The reinforcer is the type of consequence that increases the behavior. So the instruction is the signal. Question 39. If a client engaging in a challenging behavior is immediately given a break from a difficult task, and the challenging behavior increases in the future when faced with difficult tasks, this is an example of A. Positive reinforcement. D. Positive punishment. C. Negative reinforcement. D. Negative punishment. Answer: C. Negative reinforcement. This question asks you to identify the type of consequence based on the scenario and the effect on behavior. The behavior is the challenging behavior. The consequence is being given a break, which means the difficult task, an unpleasant stimulus, is removed. Because the challenging behavior increases in the future when faced with difficult tasks, this means the removal of the task was reinforcing. Since something, the task, was removed and the behavior increased, this is negative reinforcement. The client learned that doing the challenging behavior makes the unpleasant task go away, making them more likely to do it again in similar situations. Question 40. What is the main purpose of collecting inter-observer agreement? IOA data. A. To see if the client likes the intervention. B. To check if different observers are recording the behavior consistently. C. To see if the intervention is working. D. To train new RBTs how to record data. Answer: B. To check if different observers are recording the behavior consistently. This question asks about inter-observer agreement, IOA. The name itself provides a clue. Inter meaning between, and observer agreement meaning different observers agreeing. IOA is when two or more people independently collect data on the same behavior at the same time and then compare their results. The purpose is to ensure that the behavior definition is clear and that different people are measuring the behavior the same way. This helps ensure the data is accurate and reliable, while IOA is part of a good system that helps evaluate if an intervention is working, or can be used in training. Its primary purpose is to check the consistency and reliability of the measurement itself across observers. Question 41. What is a key characteristic of a well-written behavior goal? A. It is easy for the RBT to measure. B. It targets multiple behaviors at once. C. It is observable and measurable. D. It is set by the client's parent alone. Answer: C. It is observable and measurable. This question is about writing good behavior goals, or objectives. For a goal to be useful in ABA, you need to be able to clearly see and count or measure the behavior targeted. A goal like client will be happy is not observable or measurable. A goal like client will smile or laugh at least 5 times during social interaction periods is observable and measurable. While being easy for the RBT to measure is a benefit, the core characteristic is being observable and measurable. Goals usually target one specific behavior or skill, not multiple unrelated ones, and goals are part of the overall treatment plan developed by the supervisor, not solely by the parent. Question 42. Which procedure involves reinforcing any behavior except the challenging behavior? A. Differential reinforcement of incompatible behavior, DRI. B. Differential reinforcement of alternative behavior, DRA. C. Differential reinforcement of other behavior, DRO. D. Extinction. Answer: C. Differential reinforcement of other behavior, DRO. This question asks about a specific type of differential reinforcement. Differential reinforcement involves reinforcing one behavior while putting another on extinction. In DRO, you deliver reinforcement if the challenging behavior does not occur for a specific period of time. It doesn't matter what other behavior the client does, as long as it's not the target challenging behavior. DRI and DRA reinforce specific alternative or incompatible behaviors. Extinction is just withholding reinforcement, so BRO means you're reinforcing the absence of the target behavior, whatever else is happening. Think of it as reinforcing any other behavior. Question 43. What is the purpose of using a token economy system? A. To provide immediate access to highly preferred items. B. To teach the concept of earning and saving for larger rewards. C. To punish challenging behaviors. D. To replace all other forms of reinforcement. Answer B. To teach the concept of earning and saving for larger rewards. This question asks about token economies, a type of reinforcement system. In a token economy, clients earn generalized conditioned reinforcers, tokens, points, stickers, immediately after performing a desired behavior. These tokens can then be exchanged later for larger, pre-selected backup reinforcers, toys, activities, privileges. The main purpose is to bridge the gap between behavior and a more significant reward, teach delayed gratification, and allow the client to access a variety of reinforcers. It's not about immediate access to everything, punishing behaviors, or replacing all other reinforcement like praise. It's about teaching value and earning. Question 44. Which situation requires an RBT to report suspected abuse or neglect? A. When the RBT observes visible signs of abuse. B. When a client makes a statement about being harmed. C. When another RBT tells you they suspect abuse. D. In all of the above situations. Answer. D. In all of the above situations. This question is about the RBT's mandatory reporting responsibilities. Suspecting abuse or neglect is a serious matter, and RBTs are mandated reporters in most places. This means you are legally required to report your suspicion. This responsibility extends to observing physical signs, hearing a client disclose harm, even if they are nonverbal or it seems unlikely, or receiving information from a colleague who suspects abuse. You don't need definitive proof. The requirement is to report a suspicion. Always report immediately to the appropriate authorities, like Child Protective Services or Adult Protective Services, and inform your supervisor according to your agency's policy. When it comes to potential harm, err on the side of reporting. Question 45. What is a generalization of a skill? A. Performing the skill only in the exact setting it was taught. B. Performing the skill with the same person who taught it. C. Performing the skill in new settings with new people or with different materials. D. Performing a completely different, unrelated skill. Answer. C. Performing the skill in new settings with new people or with different materials. This question is about generalization, a crucial goal in ABA teaching. Learning a skill is great, but it's truly useful when the client can use it in different situations, not just the specific place, with the specific person, or using the exact same materials it was originally taught with. Generalization means the skill spreads beyond the initial teaching conditions. Option A. And B. Describes skills that have not generalized. Option D. Is a different skill entirely. Teaching strategies specifically target generalization to help the client use their new skills in their everyday life. Question 46. Which term refers to the environmental events that happen after a behavior? A. Antecedent. B. Stimulus. C. Consequence. D. Behavior. Answer. C. Consequence. This question returns to the ABCs. We've covered the antecedent, before, and the behavior, the action. The term for what happens immediately after the behavior is the consequence. Consequences can be things that increase the behavior, reinforcement, or decrease it, punishment. Understanding consequences is key to figuring out why a behavior continues to happen. So, remember, A comes before B, and C comes after B. Question 47. If a client is engaging in a behavior due to pain or illness, what should the RBT do first? A. Implement the behavior intervention plan. B. Give the client reinforcement. C. Report the suspected medical issue to the supervisor. D. Ignore the behavior. Answer: C. Report the suspected medical issue to the supervisor. This question highlights the importance of considering medical factors and the RBT's responsibility to report. If a client is showing signs of pain, illness, or discomfort, this could be causing or influencing their behavior. Implementing a behavior plan designed for a different function or ignoring the behavior could be inappropriate or even harmful. The first step is to communicate your observation and suspicion of a medical issue to your supervisor immediately. They will then determine if medical consultation is needed before proceeding with any behavioral intervention. Always prioritize health and safety and involve your supervisor with medical concerns. Question 48. What is the primary purpose of data collection in ABA? A. To justify the cost of services. B. To show parents how much progress the client is making. C. To make informed decisions about the client's program. D. To compare the client's progress to other clients. Answer: C. To make informed decisions about the client's program. This question asks about the main reason we collect data in ABA. While data can help show progress to parents, B, and might be used in reporting, A, its fundamental purpose is to provide objective information that guides the intervention. Data shows if a behavior is increasing, decreasing, or staying the same, allowing the supervisor to determine if the current strategies are working or need to be adjusted. You should never compare clients' progress. D. Data is like a map and compass. It tells you where you are and helps your supervisor decide where the program needs to go next. Question 49. When teaching a client to brush their teeth using a task analysis, reinforcing the client after they complete the last step in the chain is called A. Forward chaining. B. Backward chaining. C. Total task presentation. D. Shaping. Answer: B. Backward chaining. This question is about different ways to teach a behavior chain, a sequence of steps. In backward chaining, you teach the chain by starting with the last step. The RBT completes all steps except the last one, prompts the client to do the last step, and reinforces them for completing the chain. Once the last step is mastered, you teach the second to last step, and so on, always reinforcing after the final step is completed independently. Forward chaining teaches the first step first. Total task presentation attempts to teach all steps in every trial. Shaping involves reinforcing closer and closer approximations of a single behavior. Backward chaining is specifically about teaching the last step first. Question 50. What is the purpose of a mandated reporter in the context of ABA services? A. To provide legal advice to clients. B. To report suspected abuse, neglect, or exploitation to the proper authorities. C. To ensure all therapy goals are met on schedule. D. To mediate disputes between clients and their families. Answer: B. To report suspected abuse, neglect, or exploitation to the proper authorities. This question reinforces the concept of mandated reporting, which we touched on earlier. Mandated reporters have a legal and ethical obligation to report any reasonable suspicion of abuse, neglect, or exploitation involving vulnerable individuals, such as the clients you serve. This is a critical safeguard to protect clients. Your role is not to investigate, provide legal advice, manage therapy timelines, or mediate family issues. Your specific duty as a mandated reporter is to notify the designated authorities, like Child Protective Services or Adult Protective Services, when you have concerns about a client's safety due to potential abuse, neglect, or exploitation. Remember, your report is a crucial step in protecting vulnerable individuals.